when is it appropriate for a physician or a pediatrician, for that matter, to make a diagnosis of FAS when they know there was maternal alcohol exposure and someone meets the criteria for the full-blown FAS? Is that okay to do?
I'll tell you that the problem right now is not in people making too many diagnoses, but rather that people are not going out there and saying that there is an issue called fetal alcohol syndrome that could be affecting the child. I really feel comfortable in individuals who are trained to recognize and diagnose this, to actually make the diagnosis. I don't have any problem with people doing that as long as they follow the criteria at least set forth by the National Center on Birth Defects and Disabilities, the CDC, NIAAA. It is a guide, and so there is still some clinical judgment that goes in that. It is very important, I think, to also at least be cognizant that there could be rule-outs or other comorbidities, and I think there is room for people who diagnose FAS to still have an understanding that there could be other things going on with the individual, neglect, abuse, things like genetic conditions. I think if they know their limitations, at least professionally, they can make the diagnosis, but recognize that there could be other things that go on in the individual.
Yeah.
Making the diagnosis, however, I think is really the first step. And if you say, well, an individual has all three facial features, growth deficits, below 10th percentile, at or below really, and then you have microcephaly or a small head size, and you know that this is a child who was not necessarily just deprived nutritionally and that's the cause of all that, then it is quite clear that this is a diagnosis of fetal alcohol syndrome, and especially, of course, if you have known exposure to alcohol in utero or prenatally.
So you believe that a diagnosis of FAS or an FASD would be helpful for the child or adult possibly and their family to have the correct diagnosis?
I really believe that, and then the reason is a lot of times people think that it is just gonna stigmatize the child or the family, but the real issue might be, what do we need to know and understand about the child? We have to start there. And when we have a diagnosis, then we are able to look into what kinds of things are common in this particular condition, what kinds of other issues should we look into knowing that there is prenatal alcohol exposure and the diagnosis of FAS, and what are the management strategies that have been seen by other families to be helpful to this kind of individual. And actually there are now some evidence-based interventions that are specific to fetal alcohol syndrome. There's an intervention to help children with math, developed in Emory University. There is an intervention that helps with social skills, developed in California. And then there's also some interventions that are quite intensive and involve helping families through the difficulties of addressing the brain-based challenges of FASD in real life, the behavior issues that crop up and that need support probably for an extended period of time.
So at your clinic, once you make the diagnosis, you don't just send the family out the door.
I do not believe that that is the right approach. I believe that if you make the diagnosis, there is a responsibility that is attached to that, and that is to know where to send the family for more help and to really be able to advocate for that child in all spheres of that child's life, be it in early intervention or the school system. And I keep talking about that because those are the main places I think that a child would need help. All the way through 18 or maybe 21 in some cases at least. And then eventually maybe in the legal system, justice system, because some individuals with FASD unfortunately do have some issues in that particular arena because they weren't identified and therefore go with the wrong crowd, and really some may go to the criminal justice system because of lack of intervention early on.
Right.